leak urine at some point in time in their lives. And what if I were to tell you that 68% of them never ever visited their doctors? The problem with our society is that women always place everyone else in front of them. So when we have the younger women in our society, they would always place their husbands, their parents in front. They would never come out and say that they have this problem. Even in my clinic, I was discussing with some colleagues here. Even when these women come to my clinic, it's not that this becomes their first complaint. The complaint is A, B, C, D, E, and if you keep probing again and again and again, then they will come out and say, okay, I also have this problem. That is never their first complaint. When you talk about the older women of our society, again, they feel that they have so many responsibilities. They have small or children who have become big now. They can't really come forward and tell their sons and daughters and daughter-in-laws that, I leak urine very often. And they also feel that if I mention this, I will be taken to a doctor who's going to do either some surgery or give some medicines. It's going to be a harassment to everyone. So best is don't talk about it. So 68% never consult their GP. And 6 out of 10 women keep saying that they just feel that they have to put up with it because there probably is no solution for it. 1 out of 5 women only wear dark clothes because they feel that they might just leak urine any point in time, and if they wear dark clothes, the stain will not show. 23% always cover their bottoms. 75% would avoid any exercise in a group area because they feel that if they leaked urine at that point in time, someone would notice. 1 out of 5 women will refuse intercourse on some pretext or the other just because they're scared, they're embarrassed that if they leak urine at that point in time, their partner would get to know what the problem is. And 56% avoid social events. This might just seem a huge figure, absurd figure, but trust me, there are women coming into the clinic every other day and saying, Doctor, I like to stay in my 4 walls. I do not like to go out because I'm always scared. I'm going to leak some point in time and it's going to be very, very embarrassing. So I don't like to go for social occasions. I don't like to go out anywhere. What is stress urinary incontinence? So it is the loss of control of urination during increased movements of stress on the urethral muscles. So these are the muscles which are told by our brain that no, I'm sorry, you can't just leak urine or pass urine any point in time anywhere in public. So the brain tells us contract the muscles and hold the urine back. And when the brain tells us that yes, it is all right to pass urine, the muscles relax and the urine comes out, even if you are under moments of stress. When we talk about stress, we're not talking about psychological stress. We are talking about stress like coughing, sneezing, laughing, those kinds of stress which we undergo probably 10 times in our life. And things like laughing, we would probably want to undergo the entire day in our lives. But yet there are women who leak urine when they probably have just a sneeze, or maybe they laugh at home, they will be leaking urine because there is a problem with these muscles. They have small to moderate leaks, so it does not necessarily mean that they have a very large leak. But whether it is small or whether it is large, the problem is definitely a big one. And happens during increased pressure. So when this phase becomes this phase is when you have a stress urinary incontinence. It's more common than you think. We keep talking about hypertension, diabetes, blood pressure, and cancer, and so on and so forth. As this and so many other studies show, incontinence is a much bigger problem than all the other problems that we see. A lot of figures here, but there is a growing prevalence of urinary incontinence across the world. And there was one study which was done by Procter & Gamble. When we talk about, say, diapers, we would obviously, the first thing if I asked you, who buys diapers? You would say every mother buys a diaper because when they have babies, they want to buy a diaper. The adult diaper market in the world is much bigger than the child diaper market. And that is what the Procter & Gamble study showed. And that is what I tried to show in this very busy slide, that it's a huge market. Who are at risk for developing SUI? Again, when I was speaking to certain reporters before I started this presentation, I said if I give you just 2 indications, you will understand how big the problem is. Pregnant women. So every woman gets pregnant, and pregnant women can at some point in time leak urine because their muscles become relaxed. And there is a baby which is pushing the bladder down. Women who achieve menopause, again because the muscles become relaxed, they become atrophied. And again, women in our society, our country don't exercise so much, so there is a more of a tendency for relaxation of muscles. So both these groups of women will have a tendency to leak urine. Over and above that, when they have a vaginal delivery, especially if they have a forceps delivery, the tendency of leaking urine will be much more because there is some damage to the tissue or the other. So females are more likely, so it's not that the men don't leak, women leak more. Pregnancy itself is a risk factor, vaginal delivery even more so, even more if forceps is used. Overweight or sudden weight loss. So obviously if your weight is on the higher side, or if you suddenly decided to take the help of some celebrity nutritionist like Juhi here, or you've been exercising suddenly, doing severe weight loss, just because you had a sudden weight loss, you also could be having incontinence because your muscles have become weak. Chronic cough. Smoking, not so common in our country. Menopause by itself is a risk factor, and some certain pelvic surgeries again can increase your chances of having incontinence. So if you probably look around you, every woman will fall into one or the other of these categories, which is why it is not surprising that we say 1 out of every 3 women will suffer this problem at some point in time in their lives. So what are the treatment options for stress urinary incontinence? Kegel's exercises, easier said than done. You will probably find it all over the website. Everyone speaks about it, but if you understand, there are specialized people required to help you with Kegel's exercises. Honestly, if you ask me, I can't tell you. I will give you a very simple, stupid, layman kind of a answer. But when you try doing it, it doesn't work. Probably in the US, there are some specialized people. In India, there might be some. Calcutta definitely has none. So easier said than done. Medicines, fantastic. Definitely will give you relief instantly. But what are we looking at? Are we looking at control? Are we looking at cure? If a control is what you're looking at, medicines is the answer for you. Take it lifelong, you'll be absolutely fine. But you have to keep taking it all the time. Whether it is small, whether it is large, there will always be some side effects to all the medicines. Do we want those side effects? Surgery, fantastic again. But how about me having a very small amount of leak? And you as a doctor telling me, let's do a surgery for it. It's almost like using a hammer to kill an ant. I will obviously say no. Does it mean I need to suffer till such time my problem becomes so big that it can be, or rather can or should be corrected surgically? Second, I will require hospitalization. I will require anesthesia. More important, I will require a credible person who can do that job. So what it requires is a urogynecologist, which is a very rare breed. Probably there would be 1 or 2 in Kolkata. There probably would be few across the country. Again, after you've decided everything, the last question you are going to ask me is, Doc, what is the guarantee that I will be cured? And I'm sorry, there are no guarantees. In no surgery can we ever give you a guarantee. So what we are looking at is something in between, wherein my problem gets corrected, cured rather. I don't have side effects. It's a simple procedure that I can just take any point in time and walk away without having side effects. The women in the Western world exercise. They are far more aware. They probably will even go to their GP if they sneeze 1 time extra than they normally sneeze otherwise. Yet, the US thinks that they need to make women more aware, which is why they are celebrating November as the Bladder Health Awareness Month. Because they feel whatever they've done till now is still not enough. They will still need to make their women aware, they need to make their families aware, and they need to make people aware of the treatment modalities for such problems. In India, women don't exercise. Women don't even come forward with their problems. I would assume that the problem is bigger in India than probably in the Western world. Yet, we don't even come out and discuss problems like stress urinary incontinence. So what we are trying to do at the Renovare Clinic is 2 kinds of treatment for stress urinary incontinence. One is PRP or platelet-rich plasma, and of course this new age treatment that is fractionated CO2 laser or Femi lift, with or without the use of enhanced cell-based therapy like PRP. So what is PRP? PRP is nothing but platelet-rich plasma, that is your own blood is taken out, processed in a certain complicated manner in which the growth factors are enhanced, certain platelets are activated, and then that is injected back into specific parts of your body so that regeneration happens. The world has woken up to PRP, and why I put up these three pictures is because these are the three celebrities who have come forward vocally and have extensively used PRP for their benefit. So Kim Kardashian wanted to be young forever, and she's used it on her face. Rafael Nadal came back after injury, and he came back with a bang this year, and the injury was, rather the recovery from injury was because of PRP injections into his knees, and so did Tiger Woods use PRP for rejuvenation. So what it is doing is wherever it is going to be injected, there is going to be rejuvenation of those tissues, new blood vessels are going to form, and that area will become much better than what it was earlier. And that is what we are trying to use for stress urinary incontinence as well. Collagen shrinkage. Because of the collagen shrinkage, some tightening happens. New collagen is formed, and we know that when we age as well, whether it's on our face or anywhere else in the body, because of loss of collagen is why sagging happens. And so when new collagen is formed, the tightening happens, and probably that you never have to take a treatment done again. Probably some of them may not require treatment, because again we are saying 3 sessions is what is required for good treatment. There are so many women who with one treatment don't want to come back because they're totally relieved. But we can't take them as a benchmark. So 3 sittings is what we are saying, and we are saying not even 36 months. We're saying 1 to 1.5 years you should be absolutely fine. Maybe after that you might need to come back for 1 sitting a year, or maybe 1 sitting in every 2 years, wherein the effect could be more prolonged. Besides using it for stress urinary incontinence, it can also be used for, that is Femilift can also be used for a host of other problems like vaginal atrophy. So women who are menopausal have undergone atrophy of their vagina. It's very dry. There is no reason to believe that just because a woman has achieved menopause that she can't have intercourse. She has a host of other problems also because the vagina has become very dry. Femilift helps in this area. Recurrent vaginal infections. So we as gynecologists get patients every other day, women who have vaginal infections. Femilift is not the first indication. We give them medicines, we treat their partners, but sometimes it happens that nothing seems to work, despite us feeling that there doesn't seem to be anything wrong. So Femilift again comes in there. Post-delivery rehabilitation, especially for women who've had normal vaginal deliveries with or without forceps usage. Lichen sclerosis is again a terrible problem that some women may face. Treatment again is very, very difficult, frustrating. Femilift is again being used for this indication, and brilliant results are being achieved with its usage. Cancer patients, I've already told you that because of, say, radiation being given in the vagina, if there is scarring of the vagina, Femilift is again helping them at least make it more moist, make it easier to live with the entire treatment. And of course, women who've had episiotomy scars, healing of that episiotomy scar becomes much, much better. So, for those, and those huge number of women that have been living with incontinence, people around us, people in our city, people in our country, we hope that we'll be able to bring forward 2 very, very new age treatments wherein we could give them a lot of relief in their problem which plagues them every single day of their lives. Thank you so much for a patient hearing.